how could people be better served in the community with respect to brain tumor awareness to help improve outcomes for patients? Well, I'll follow that with a here and say that, yeah, if it's kind of there's a lot in there. So there aren't that many emergencies. A lot of people don't recognize that. 97% of ambulance rides are unnecessary. You probably didn't know that, but 97% of them are. People could just sort of get in their car and go to get it dealt with. Now, 3% of them are legitimate, heart attack and stroke and, broken neck or whatever. But so we really overutilize emergency services. And the same thing applies to things like surgery. Brain tumor surgery, most of the time, there are a few emergencies with brain tumor surgery, but most of the time it's not an emergency. And that's a very, to know what's an emergency in a brain tumor scenario and what's not is not something that is ever going to be sort of general knowledge. So for example, why would a person ever need an emergency brain tumor operation? Well, if they have a big brain tumor in the back of the brain that bled and it's shutting off the spinal fluid flow from the upper part to the lower part of the brain. Well, if you don't solve that problem within a very short period of time, the patient will die. And those patients need an emergency operation. So that is an emergency. Sometimes there's so much swelling on the brain from a primary brain tumor, it's an emergency. It's got to happen now. Yeah, but most people, the clinical situation that tells you it's an emergency is the patient's in extremis, the patient's in trouble, the patient's not waking up. These sorts of things. And everybody's looking at the scan saying, holy smokes, Batman, we got to deal with this now. So, but if you, as a patient, have a seizure and then you're sort of okay and back to normal and somebody tells you you have a brain tumor, you've got time to get that dealt with in a, relatively subacute way. You can make an appointment to meet with a specialist, and most of the time, myself and my partners, we'll see patients the same or the next day, or certainly within 2 or 3 days after they find out they have a problem, which is always has to do with an MRI scan or a CAT scan. So for the vast majority of these tumors, patients have time to get sufficient opinions from experts. They can even see several experts to get a number of good opinions. The reason for that from a surgical standpoint is that you really want to have a good operation at the beginning. You don't want to have a halfway operation and then run into problems because only an insufficient amount of the tumor was removed. So then you're dealing with these other issues later on because of that. So you need that sort of accumulated good information at the beginning so you can start right. So that's one thing, sort of to follow what you were saying, how the general public could help make things better is to sort of take a step back, realize it's not an emergency, and get a couple of expert opinions. The other thing I was sort of thinking along those lines before we got into that was really people recognizing that it's really vital that people seek out experimental treatments because we need to move those forward faster. Most of our experimental treatments are not going to work. 95% of them, 99% of them are going to fail. But we need to fail faster. That idea is kind of unique. We need to keep making these wrong turns so that we can get that right turn and stay on that path. And we have to do that by wrong, right, and then we're on it. And the nice thing about that is that knowledge that grows out of that discovery that, say this drug we're testing works, there's knowledge that's going to emanate from that we can't even predict. So that's very important.